received a call from a truck driver. This gentleman gives us tips, various tips. He's all over Detroit. So he sees dogs that he feels like need to be checked on. So he called me and he said, you know, he wanted me just to come over here and do a wellness check on this dog. The dog has no shelter. And so I said I would. So we're out here right now checking this poor boy. And he does look like he's in pretty good shape, other than he has no shelter. So the law here in Detroit does require that dogs that stay outside 24/7 have shelter. But we'll try to make contact with the owner, the homeowner here, and just ask him, you know, if they need some assistance, or, you know, why is the dog out here with no shelter? Perhaps they only put him out, you know, to go potty. We're not sure. So that's why we like to ask and find out. Yeah, actually what happened was the person who contacted us was running after a Chihuahua, then saw this dog. And it's dragging a chain or a lead. That's actually the nephew of the owner of this house. He just explained to us that the dog actually does go up into this porch area at night. He doesn't stay outside all the time. You know, he just gets put back here, I guess, for a minute to go potty, and then he gets brought back in. But we're still going to make contact with the owner and just tell him, you know, if the dog stays out here for any extended period of time, you need to have a dog proper shelter, you know, and things for the dog. And we'll offer him some assistance. If he wants to have the dog neutered, we'll pay to have the dog neutered, and just, you know, try to educate him a little bit. The reason why the truck driver called us yesterday is because he saw a Chihuahua running through the streets that had a leash, dragging a leash, and so he was following the Chihuahua who got away from him, and then he came across this dog. So we'll be out looking. This happens often. We'll be out looking for one dog or one situation, and then somebody calls us and, you know, oh, there's another dog over here. So our leads follow us in all different directions. You know, that's how we come across a lot of dogs here in Detroit. All right, now we're going to get a puppy.
Looking for the dog?
Yeah.
Larry just gave me your keys to the truck.
It's in that silver pickup truck right there.
Oh, the one with the dog?
Yeah.
I did tell her this puppy does have to be under 15 pounds because we don't have any big runs left at our veterinary hospital. So if it's more than 15 pounds, we will not be able to take the dog. Which it is more than 15 pounds.
Yep.
It's like, so,
It's a girl dog.
yeah.
I don't know.
Okay, so this is going to be our problem. We will not be able to take her. I was very clear. Oh, and she has, Lori, she's got puppies somewhere. So we're going to have to, okay, so this is not a puppy. This is a nursing mom dog.
Oh, she does.
And she's owned. So what we're going to have to do now is try to find her babies. Because there'll be babies that are dying out there if we take her. All right, so
Yeah, baby, so we have to walk around with her.
where exactly
So a
did
lot
this
of
dog
times-
show up? Does anybody know?
That berm right there.
Vinny, you
A
know
lot
where
of
it
times animals
showed up for you guys?
They live under that bridge.
No.
Hi, Mama. Hi, Mamas. You're a good girl. Hi. Say hi, Mom.
What's your next move? What's going on
Now we're
here?
going to try to find her babies and see if she can lead us back home. We have a trick that we use.
What's that trick?
The trick is we play the sound of puppy crying music.
There it is. So she's
And
got
just
it there.
hold her for 1 second. I'm just going to go tell them what's video. This dog is owned, guaranteed. She's in too good a shape. Plus she has the choke collar on her.
Yep.
And I want to go back and tell them if we can't find the babies, I'm bringing her right back here. Because I was very clear that we couldn't take a dog over 15 pounds. I do not have any place to put this dog.
Anyone to call either that you think you would?
No. We're completely full. I have a line backed up. I have a line of 58 dogs waiting to be picked up.
Thank you. This is like
A new star. I don't know yet.
So what's the story? You're not on, but you can talk.
I saw these puppies outside his fence one day in this driveway when I was driving down the road. And so I got a hold of him and asked him if he needed help with them or anything like that. And he had to have 2 left that he needed to find homes for. So I contacted Teresa.
All right.
Because they need good homes.
Yeah. Hi, how are you?
Good, how you doing?
Let's see that guy. Any name ideas?
You know, I don't know. I was gonna actually keep him. He's the bigger of the 2, I think.
Yep. But you switched your mind?
Well, my kid did.
Oh.
How many total were there?
Oh, hi.
8.
Hi.
She's full-blooded German Shepherd, and you know the dad looked like this, kind of like brindly. So I just assumed
They
Boxer
got
paid.
huge feet, though.
Yeah,
He
right.
might even been part Mastiff. Look at the size of those feet. Holy God.
Hi.
Aren't they
Nice feet,
adorable?
They are
baby.
awesome. He's a great dog.
I love you. And I love you.
So yeah, they'll get good homes.
Oh yeah.
Their feet are huge, though. They're gonna be
I love you.
other shot stuff.
I love you.
Carries them same thing for the puppies. So yeah, we gotta get your female
Hang out at my
fixed.
house.
Yes.
You want to come hang out at my house?
Yes.
I love you.
He's like, get off me.
Will you stop?
What
Get out
do
of
you
my
think? You want to be on film?
Something else. Isn't it?
It's so adorable.
So you got homes for the other folks. They're all good.
They're all good. They're all.
Come on, let's take a ride, shall we? Shall we take a ride?
That's all.
You are a cutie. Super cutie.
Boy, you're a big, big boy, aren't you?
Yes.
Turn the car on. It's hot. We're right there. Oh, my arm is breaking.
Oh, come on. You're fine.
They're cute, aren't they? They're gonna be big. That one's gonna be huge. Huge. What do you think Dad was? Mom is pure shepherd. I don't know what Dad is, but oh jeez. I'm trying not to be in the way, but she won't take the dang dog. Here's your friend. Okay.
Thank you. Yeah, we'll take I had first round of shots and dewormed. I gave we got the records, the shot records, so we'll give them a Bordetella and coming back this way. Ariel or Sarah? Ariel or Sarah? Can I put it in the cooker? We're gonna spray these little babies. And you know what? We'll put them both together. Yeah. Because I think that they'll do really well. We'll wash you guys up.
Who's this?
We're gonna wash you guys up after.
You want front line?
Yeah.
Hi, my name is Sherry Franz. We're here at Centerline Veterinary Hospital, and we're going to get caught up on Courage today.
I'm with Dog Rescue. Hi, I understand you guys got a puppy in there?
Oh, I don't know. You'd have to go inside. They got it.
Okay, thank you. I just texted Heather, so thank you so much. Aw. So this poor guy. Hey, bud. What happened to you? Oh my God. Oh, this is not good.
I know. You see all that blood?
Yeah, this dog needs to see a vet immediately. He looks like he was severely attacked. So what happened? So tell us the story real quick.
Some two guys came up here. Well, they called, but like we have this dog. We found him in a box. He's very hurt. We don't know what to do with him. And I was like, bring him here. I know somebody we can call. We got this.
Yeah, I'm going to rush into emergency vet right now because he's torn up. So, hey, bud, we're going to, and he smells like infection too.
I know.
So we'll get him to the vet immediately. How is he? What's his temperament?
They carried him in.
Okay.
They had him wrapped in that jacket thing, and I said, well, since you already had the report, can you just throw him in the cage?
Right.
I don't want to,
Right.
I don't even know if he can walk.
He don't look like he's moving very. Yeah, he looks like he's.
That's why he has those guys sit down.
Yeah.
Yeah, it's even worse than what the pictures depicted. So it's been a minute since he's had this because he's full of infection. I can smell the infection.
Yeah, the eyes.
Come here, bud.
His head looks swollen.
Yeah, he's got some contusions. Yeah.
Because it looks like he was dragged almost on the face up there.
Yeah. So I'm not sure that we'll be able to save him, but we're gonna try. Come here, bud. I just don't want to hurt him. Are you friendly? I'm going to be honest. I don't think we're going to be able to save him, but we're going to try. Come here. Come on. Come on. Look at his ears all bloody. Come on. I actually have some blankets out there. I just want to get them.
You're just going to scoop them up. You got blankets in your truck?
Mm-hmm.
Hey, slide that trailer, yeah.
Yeah, that's a severe head injury we're looking at here.
Got a blanket or something we can wrap him up?
Yep. She's actually, I think she was, you want to hold that real quick?
Yeah, I
Go
got
grab
it.
it. I just need somebody to let me back in, that's all. Poor little dog took a beating.
Oh, yeah.
Thank you.
Oh, look at that.
Yeah, that's severe. Okay.
Come on, Hanson. Good night.
I love his little underbite.
I got you. We're going to go for a walk. You want to go for a walk? We're going to go get you kibbles and bits. Come on. Come on. Oh, big boy.
Thank you. Thank you. Can I just get a picture of you? You don't have any jealous girlfriends' wives? Okay. Thank you.
1 East Fargo Burn. It's going to be an EN 1 on 740 St. Louis. 740
Okay, thank you so much. Right here is fine. Yep. And then I'll just tie his leash so he, in case he gets up, I don't want him to. No, that's a beating. Yeah. Because I don't see a lot of I don't see no road rash, bite marks.
Yeah.
But they'll be able to determine more. I was going to take him to Dick's, but I'm not sure they're capable of handling this.
He might have a broken jaw underneath this.
Yep, we'll get him. I'm thinking advanced medical care. He's all right. I'm not even going to leash him in.
Counts as a good beat, right?
That's bite wounds that I'm looking at there. All right, I'm going to rush him to the vet. Could have been, or sometimes people just have a big dog that attacks a small dog, or who knows. All right, thank you for calling us. I will absolutely. Oh, shit. Today we received a call from the Highland Park Police Department stating that an extremely injured dog had been dropped off. This dog was found in a box. And 2 kind Samaritans found him. As you can see, he is severely injured. He has been, appears to be mauled and beaten.
Look at a couple of things. Anytime we're looking at an x-ray, a radiograph, anything that's black is air, like the air surrounding our baby. And anything that's whiter is something that would absorb x-rays, like lead letters, bones, or soft tissue. So keeping that in mind, this is the radiograph, or one of the radiographs or x-rays we exposed initially on the 29th of last month. And we're looking and we can see this area here where this mandibular fracture is. We see a degree of bone, a jaw fracture. We can see some bone starting to want to heal and remodel in here, and here we can see where the break is. The other side, this would be the right side, this is the left side. The other side, as you can see, is nicely lined up. We are also seeing here on the top of the skull some area here where we're suspicious there might have been some injury here around the frontal sinus. We're seeing some gas under here, which we noted. Along with other soft tissues, there was gas and pus, and I believe it's coming here from the sinus. We see all this soft tissue swelling here, which was that abscess that we had seen. This structure here, that's the trachea tube. The trach tube. The baby was under anesthesia while we were doing this. Let's see, look at our next radiograph.
Can you extrapolate, though, the type of trauma from when you, I mean, are you somewhat of a detective, too? So when you see all of this stuff, you try to, like, piece together, well, how does this happen, you know?
You try, but sometimes it's hard. And so it's at this stage, you don't know. It could be anything. It could be some fall. It could be a dog fight. It could be some other type of trauma. It's hard to say.
Mm-hmm.
We're looking here. We can see here. This is called the zygomatic arch, and we can see here on the affected side that there's a fracture there, which is consistent, which just makes you wonder. Then here's the area of the fracture. We also noticed it when we had this baby under anesthesia that one of the teeth on the mandible or the jaw was fractured as well. And once this is healed up, then we will take care of that and get that fractured tooth out. So then if we go back here to today, we go forward, I should say.
So this was just today, some fresh rays.
These radiographs were exposed today. We can get this up to full size. We could even make it bigger if it makes it easier.
Oh, that's great. Perfect, yeah.
we see even more of what we call periosteal reaction. This is the fracture zone. And it's doing okay. Here's that fractured tooth, but there's nothing getting upset under here. No, the tissue is pretty happy. And we like seeing that. We see this area of the frontal sinus. We certainly don't see all that soft tissue and gas density. Again, anything that's black is air in here. So this is improving a lot. We don't have the soft tissue density. Of course, the drain tubes are out.
And that's from infection, that soft tissue and the gases take place?
Well, it doesn't have to be, but in this case it certainly was, because we know we had all that pus in the pocket. And this pet was under anesthesia again at this time. That's where this line is. That's the trach tube. And let's see if we move forward. We have another one. We can kind of rotate this around and get this up to full size. And here we see a more, it's easier to see that fracture on the right zygomatic arch. That heals. Do okay. It's okay. We'll keep track of that. And we're doing okay. Here's the area it's harder to see on the left side on that mandibular fracture. The dental occlusion is not bad. Teeth come together pretty nicely. And so I'm hopeful that we'll have a good situation for this baby. We're doing a lot better.
So it could have been, I guess, a dog bite, but then those wounds healed.
But I mean,
I don't know. It's just.
I just feel like it's blunt force trauma because
it's
until you see that air. Because he had that blood in the air.
And the zygomatic arch, the jaw, like the cheekbone, is broke on this side, and then the jaw on this side. So something like this plane of, I don't know.
Just makes you wonder.
Yeah.
And
I definitely don't think
that
it was
jaw
hit.
was so straight. It wasn't like shattered. It was boom. You know.
So you think blunt force trauma?
It could have been a car too, and just the right force at the right time. But some kind, I think trauma more so than a dog bite. Would be my guess.
Yeah.
I don't know.
And things have happened, but we didn't have anything else on the rest of the body.
Yeah.
So, yeah.
It's just. But I've seen also dogs that have gotten hit by a car that have absolutely no wounds, so you never know.
Yeah.
But
something was pretty hard.
It seems like there's.
So she still had live fleas on her. I can't believe that.
It's ridiculous. She's been sprayed and.
Yep.
Let me just put this.
I don't know if you're going to
She's a nice dog or whatever, but
her skin's not.
we're gonna before we wake her up, we'll
So I don't think that there's.
too. So yeah.
Dad, I hear you're recording for the World Awareness Society. What is that?
Yeah, you mean World Animal Awareness Society? Well, I'm a volunteer with the World Animal Awareness Society, Emerson. I volunteer my voice for use in animal rescue videos. And I don't know if you know this, but everyone at the World Animal Awareness Society is a volunteer.
But what do they do?
They're award-winning volunteer filmmakers who have interacted with 2,200 animal welfare nonprofits, including Maddie's Fund and Austin Pets Alive, providing information-rich content to more than 45 countries in the last 10 years.
Dad, what does that mean?
Okay, Em, how about this? They make short movies about animals that are in peril, that are hurting, in bad shape or dying, or homeless in the streets. They film rescuers doing heroic work so they can focus on saving lives. The World Animal Awareness Society posts the rescue videos on social media, and then they're broadcast on TV, sharing the heroic stories with people all over the world so they can understand what's really going on.
Cool. I like animals. How did you start volunteering?
Well, I met their director through social media and saw the work that they were doing and knew that I could help their cause. So I asked if I could volunteer. I am very fortunate to have really great jobs providing the voice to so many shows that I believe it's important to give back. Since I've been volunteering with the World Animal Awareness Society, they have created the 7th most influential YouTube channel for dog rescue lovers in the world, WA2S Films.
That's so cool. Hey, Dad, nice job. Do you think I could volunteer too?
You already are, Em. You already are.
You're watching the World Animal Awareness Society.
Yep, that'll do, Emerson. That'll do.
You're watching the World Animal Awareness Society.